with the Vermont Farmers Food Center in Rutland, and I'm also co-chair of the Farm to Plate Health Cross-Cutting Team. My colleague Graham is here as well.
Hey folks, my name's Graham Unang-Strufenacht. I'm the policy director at Rural Vermont, and I live in Marshfield, Vermont, and I lease some land here and do some grazing of grass-fed beef animals, do some research into perennial vegetable work and pruning in the wintertime. And yeah, I believe this slide is mine to present, and it's not much. This is sort of our first attempt to sort of like just bring you all into this conversation and get some response from you. So, part of the foundational premise of this workshop is that building coalitions, in particular intersectional coalitions, cross-sector coalitions, is fundamentally important. And why? And I think as Sarah and Heidi and Molly, who's my colleague, who's unfortunately not here today, but who spent a lot of time doing this work and really heads up a lot of our healthcare work right now, is that fundamentally all these aspects of our lives are interconnected. No matter what sector you work in, you're affected by healthcare, you're affected by systemic racism, you're affected by childcare, or you were at one point in your life, even if you don't have children, you were at one point a child. And for us to continue to sort of work primarily in our own quote unquote sectors, there's certainly some opportunities when we do that, but to work intersectionally, to approach these issues as foundational to not only our sectors, but to our sort of collective liberation and collective well-being is critical. So we wanted to ask you, what brought you to this session? And we recognize this could be an extreme philosophical answer, very qualitative, but you're also welcome just to share projects or specific subjects or issues. And yeah, so everyone just, if you have the ability to participate via chat, please share there. And Sarah, did we have a plan for how were we going to read any of these out, or just let folks see what pops up?
Yeah, I mean, there's going to be too many of them to read them all out. I think whoever's facilitating any individual slide, if you want to read a few highlights.
Great. Yeah, I mean, so many folks are responding. Thank you all. I see Lisa writes, the food system involves all systems because everyone eats. And these intersectional topics are alive in my work with food justice and food sovereignty. Sarah writing, I'm interested in learning ways in which we can build on synergies between food systems and other sectors, both sectors and create coalitions. Danielle writes, because this work cannot be done in silos. As Graham said, it's all connected. Allison is writing, I see the challenges we face in the food system as symptoms of larger failures that also create problems in other sectors. We need to collaborate across sectors in order to address the underlying system issues. And folks, why don't you just keep, you can see there's a lot of folks writing in. Seeing folks identifying big issues, childcare, healthcare, they need cross-sector participation to change. Someone's saying I work with hospitals. I'm interested in connecting the producer POV with what hospitals are doing, point of view, I imagine. Grace writes, we're stronger together. Erica writes, we can't change the food system without intersectional system change across many issues. We can't change many important societal issues, whether it's poverty, inequity, poor health, fair working conditions, without changing the food system. Yeah, so many great things being brought up here. I'm going to pass it back to Heidi.
Graham, your audio is periodically a little bit garbled, just to warn you.
Okay, I'm going to see if I can call in.
Thank you, Graham. And thanks to everybody again for your comments here, and wonderful to see, so many creative thoughts and themes, and we'll be digging into those today. But what I am here to share a little bit about is we thought that it would be helpful for this session to offer a little bit of specific examples related to the work that the Farm to Plate Health Cross-Cutting Team has been doing. And we've been working in that space of cross-sector collaborative work, specifically moving the needle regarding the intersection of healthcare and the Vermont food system and ag viability. So the health cross-cutting team, we were actually we grew out of the food access cross-cutting team a few years back. And we've built networks and coalitions around the shared values of improving health of Vermonters and supporting the economic viability of farms. And we've seen how this investment in local food initiatives, working in partnership with healthcare, has demonstrated a pathway and strategy for change. And the effectiveness of this speaks to many of the themes that everyone was just pointing out, in that by addressing the multiple social and environmental contributors to health, we're getting at the root causes and the interplay of the culture and social aspects that shape our health and what we do. So in thinking about our initial coalition building work, there were sort of 4 themes that emerged that I thought would be helpful to frame the work that we've been doing on the cross-cutting team. And then also, as we get into the next section of our discussion today, we're going to be looking at the specific briefs and just thinking that some of these themes might be helpful as we think about the topics and recommendations in the briefs, and then how we're going to address thoughts on what we can do next in terms of priorities. So the first of those themes that arose was champion. So in thinking about this work, initially finding willing leaders and those that are there and showing up and willing to build these collaborative coordination of activities. So in terms of the health and farm to plate work, and I'm specifically sort of referring in the realm of working with produce prescription projects and food as medicine. So partnering with clinical providers and doctors to actually prescribe CSAs and farm shares as part of a care plan, and then at the same time impacting the ag economy by purchasing that food directly from Vermont farms and sourcing it from Vermont farms. In the sense of this work, we've seen partnerships from doctors, healthcare providers, organizations like Blueprint, Department of Health, Green Mountain Careport by state, and all of those entities willing to sort of think and engage outside the box and participate, not only in just directly making referrals for patients to receive these farm shares, but also allocating staff and resources to coordinate and track activities. And then certainly there's the farmers and their willingness to participate in this sort of alternative market and model for delivering and getting food to Vermonters, and then the patient members as well. So willing to show up and say, yes, I'll give this a try. And I'm interested in, this different approach to traditional healthcare, and then seeing those members also become patient leaders. We've also seen how specifically to the second theme in creating space, that the farm to plate cross-cutting team has really evidenced how just by being an entity and being a team, we created space for sort of a landing point for folks who are interested, and have shared interest in this work and passion for this work. And this has been a place to convene. So in that convening, something that I think is really powerful and we'll continue to talk about throughout today is how that space can help break down perceptions of barriers. So one example that comes to mind in this regard is often when folks are looking at starting a type of food as medicine type project, or working to collaborate with healthcare, there's this perception that, oh, doctors are already so busy and have enough on their plates. How can we possibly think that they'll incorporate this new, not to mention sort of alternative, outside of the norm program? And then by having this coalition in this space to share from experience, that actually we've seen quite the opposite. There's really a lot of willingness and eagerness on the part of doctors and our healthcare partners that they want to try this new creative solutions. They're also really creative at figuring out ways to incorporate existing resources and practices to make this happen and coordinate our activities, and how together like that we can really become drivers of patient engagement and therefore change. Another, and thinking about creating space where having the health cross-cutting team exist is an example of last year, when the Vermont Department of Health was drafting their state health improvement plan, we have members, some are standing members of the team that are from the Department of Health, but we also had other members come and have dialogue with the team, and then in the SHIP recommendations, their strategies around healthy eating recommendations, as well as like food security as a standard screening question. And then one other example that I particularly like to think about in terms of what space can look like is that a lot of these clinics and hospital partners, when they're distributing the food, it's actually happening right on the campuses of these clinics and hospitals. So literally setting up like a little farm stand to do that food distribution, and how this creates not only visibility of the project and the concept, but we're also opening an opportunity for dialogue about, what's going on here, people picking up vegetables at their doctor's office. And then by having that physical presence, we're also really articulating that shared value of food as medicine and what healthcare can look like, outside of the traditional sense. And then having that local component of the food really coming from local farms, again, just hones in on that community aspect that can really be a driver of those deeper, cultural, social aspects of what we're doing. Third theme here, challenges. I mean, certainly we all, it'd be great to creatively engage, some ideas around challenges as we get into dialogue throughout the day, but I like to always think about it as opportunities, because as we know, these social conditions and systems are complex. No single entity has the resources or ability to bring about that change. So it can, take time and consistency to figure out what those pathways are. But in general, we know that there's going to be complexity there, and by addressing it together, that's how we're going to meet those needs. And then lastly, of course, creativity, and a couple of thoughts on that were thinking about adaptive funding. So we've seen in the space of the health cross-cutting teamwork where hospitals and philanthropy have had the opportunity to allocate, financial resources to these types of projects. And therefore sort of stepping outside of approaches that are isolated, but really being willing to fund and engage in spaces and opportunities that are like that collaborative in nature, because we know that the interplay of activities and entities are the only things that are going to move this cross-sector collaborative work. We recently held a panel on the Farm to Plate team where we brought, like that panelists from different healthcare entities to have, dialogue with our team specifically around funding and sort of focus on that and how these systems, how we can grow them together. So I think that's how we are creatively addressing changes. And then I just wanted to put out there too of, this is going to take risk, but doing it together and, sort of shaking it up is necessary. And then lastly, just the processes being flexible. And this was along the thoughts of how, having a space like the health cross-cutting team to share strategies and share success, we're able to empower individuals and communities to work together and find processes to do this work, but that are culturally relevant and sort of adaptable to the strengths and assets of that community, and therefore can make that work more lasting and carry on, through generations, hopefully. So I'll leave it at that. And like I said, hopefully these sort of themes and specific examples can just be helpful as we move into looking at the briefs, and then talking later about priorities and ways that we can envision creating more of this work. So pass it back to Graham.
All right, can folks hear me? I just want to make sure my speaker is working well now. Thumbs up, all right, excellent. So now we're getting into some of the actual briefs here. So Farm to Plate approached rural Vermont late winter or sometime this past winter, and asked us if we'd be interested in lead authoring the healthcare and childcare briefs. To begin with, we were talking about sort of briefs addressing critical quote unquote non-agricultural issues that could go as far as healthcare or housing as well. However, based on our capacity and the current work we had been doing, we felt that healthcare and childcare really were a lot to take on in and of themselves. As an organization, we're not experts in healthcare or childcare. However, we recognize the impact of healthcare and childcare on the lives of our members and the critical nature of it in the agricultural community. And beyond that, these are critical aspects of our social infrastructure that everybody needs access to, needs to be able to afford. And so we took that on, and so part of our work, given we weren't experts, was sort of assembling expert teams locally and drawing from national experts as well to work on these briefs. So as you can see here, and I again want to acknowledge my colleague Molly Wills, who's not with us today, did a lot of work on these and can speak to a lot of this work as well. So what you see here is a part of the what is called the what's at stake section of the brief. And I actually am going to read to you just the full what's at stake section here from the brief itself. I think it has some critical pieces. Access to physical and mental health care is directly connected to farm viability and quality of life. And I think this is really the connection we're trying to make, and the Farm to Plate was acknowledging as well with this, and really drawing attention to that healthcare costs and the cost of living have far outpaced gains in farm-based income and other forms of income in Vermont. This affects farmers, farm workers, and consumers, with ramifications from food access to farm operations. Farm families and farm workers have difficulties accessing health insurance and health care due to the high cost of insurance, including deductibles, co-pays, and policy costs, lack of or inadequate insurance coverage, and limited access to rural providers. Lack of access to affordable health care can impact farm productivity, hiring of farm workers, farm risk management strategies, farm transition, land access, and the need for off-farm income. In a national study, a majority of farmers reported they couldn't withstand a major health crisis without going into debt or selling off their farm assets. So that's what we identified as what's at stake. And now Sarah's or Heidi has brought the recommendations up here. And again, I think what's really critical to recognize in the what's at stake is one, recognizing the unique positionalities the agricultural community has in relationship to healthcare, whether you're a farm worker or a farmer, but also how this is cuts across sectors, as we said, right? We say here that regardless of whether you're a farmer or not, other forms of income, the cost of healthcare have outpaced all of them. This is a challenge for all folks. So the recommendations are, again, these briefs are, the audience intended for these briefs is primarily the legislature, policymakers, et cetera. That doesn't mean that some of the recommendations can't be non-policy recommendations, and I think you'll see that certainly. But these briefs were compelled through legislative action as a means of of strategically approaching policy work. So here the first one here is recommending a publicly financed universal healthcare system for all Vermont residents. I think we just know, if you were at a workshop that I co-led at Farm to Plate conference a couple of years ago, where Robin from the Green Mountain Care Board presented. This is a member of the Green Mountain Care Board, presented on the global healthcare situation, and it's very clear that healthcare in the United States costs more and has worse outcomes and is less accessible than almost all of the systems of our peer countries. That's a very data-driven position. I just want to dial that in. That we devote resources to working with migrant and immigrant farm workers and their advocates to address individual and structural challenges, barriers, and disparities in access to healthcare, improve effectiveness, safety, and efficiency of healthcare services for these farm workers. So again, there's a really unique positionality, especially in certain parts of the agricultural community in Vermont, whether you're an H-2A visa worker or you're a migrant worker without status. Despite the relative inaccessible nature and challenges of affording healthcare as a citizen, for those folks, there is simply far greater challenges, and for those without status, no available care outside of volunteer care at big clinics around the state. Agricultural groups, including the AFM, farmers, and farm workers, should work to influence the Green Mountain Care Board.
Graham, can you get a little closer to your microphone? I think.
Oh, I'm sorry. I keep forgetting I'm not talking into the computer anymore. So the third one is just about agricultural groups recognizing the role of the Green Mountain Care Board in affecting affordability and access to health insurance in Vermont, and that's a public process, and that those groups, we can engage with that process, we can work to affect it, we can bring agricultural voices into that process, and that's part of the work we have to do. And the fourth is, this came very directly from folks working in the healthcare field, talking about the need to create stronger network adequacy requirements and enforce these requirements. And the fifth one is, again, from the healthcare community, working with Vermont's federal delegation to provide stronger regulations on the cost of prescription drugs and urge national healthcare reform and transparency, and advocate for the USDA to represent farmers in national health insurance policy conversations. And I think I'll leave it there. One thing I just want to I'm not seeing here in the recommendations, and I want to just make sure it's not on the other document I have here. Oh, okay. Yeah, let me just read this one other off here. It says, increase farmer healthcare literacy by providing resources, offering agricultural, public health, and healthcare service providers opportunities for professional development in agricultural healthcare literacy, and consider creating a branch of Vermont Health Connect employees who could work directly with farmers. This is really just about bringing some direct technical assistance to farms. So that was our work with childcare and some of the context and recommendations we made. And I want to quickly, actually, I'm not sure how our time is doing, but I want to acknowledge some of the other authors of this brief, because I'm the one presenting it. But so again, the lead authors were myself and Molly from rural Vermont. Contributing authors were Naomi Wolcott McCausland from Bridges to Health, Mike Fisher, Amelia Schlossberg, and Eric Skolteis from the Office of the Healthcare Advocate here in Vermont. So now moving on to childcare, I'll just front load you all with the authors this time. So again, we were the lead authors, and contributing authors were Drake Turner and Ansley Bloomer from Let's Grow Kids, a Vermont-based organization, Matt Levin and Charlie Glisserman from Vermont Early Childhood Advocacy Alliance, Shoshana Inwood and Andrea Rissing from Ohio State University, and Florence Beckott from the National Farm Medicine Center, the National Children's Center for Rural and Agricultural Health and Safety. So again, part of the, the primary goals here is to underline that, childcare is fundamental to farm economics, to the farm households, and that these quote-unquote household issues are actually very real economic issues on farms. They can help to contribute how effective farms are at minimizing their environmental impact or having a positive environmental impact, folks' mental health, et cetera. So I'll go straight into just reading for you. Again, I'm sorry, this is sort of just reading a lot off the page, but I think this is perhaps what's most helpful. And if you're on the phone, this is how I can get this information to you. Childcare is fundamental to household economics and therefore farm economics. Farmers with children must continuously negotiate access to affordable childcare as the needs of their children and families change. Planning for these adjustments is part of whole farm business planning, yet rarely taken into account in farm business support. Even with financial assistance, Vermont families may spend almost 30% of their annual income on childcare. Vermont estimates the basic wage needed for 2 adults and 2 children, ages 4 and 6, to live alone and support their children is $31.75 per hour, or over $66,000 annually, which is far above a farmer or farm worker's hourly wage. Childcare is also the best way to keep farm children safe. Addressing farm families and farm workers' need for childcare is necessary to support long-term, thriving, and equitable food systems in Vermont. And there is need to further examine how national and state childcare policies intersect with farm family well-being and farm economic development. So again, on this issue, and I didn't mention it in the last healthcare one, but there's certainly other systemic issues which influence how people are disproportionately affected by healthcare or childcare and their opportunity to access it. So as we know, in healthcare, we mentioned the status of farm workers, in particular migrant farm workers, folks who are through H2A, but also folks without status. And as we also know, that within and without the agricultural sector, that folks of color and Indigenous folks and immigrant communities in general face disproportionately negative outcomes in our healthcare system. Do y'all want to go to the next childcare brief here? Actually, can you state that one really quickly? So this graphic on the right is pretty interesting, and for those folks who haven't delved into sort of what the childcare situation looks like in Vermont, this graph is very visually clear. Just where the current capacity is for different age groups and where we estimate what we need to actually achieve to be able to provide universal childcare in Vermont. Thanks, Heidi. We can go forward. All right, so recommendations, and again, a lot of these are geared towards policymakers. So to develop and enact policies which create just and equitable systems for fairly compensating farmers and farm workers. So this is again hitting at the intersection of farm viability and just livelihoods in the farming sector. and its relationship to accessing healthcare, systemically work across sectors to bring voice to and address the gendered nature of childcare and household work and its consequences on society, particularly farms. And if we were to read the rest of the brief, you'd see noted here just the sort of some of the more systemic, again, issues that impact this issue of the history of childcare being confined to particular sexes or genders in our households and in our communities, and how that impacts stress on farm families, how it impacts the perpetuating of these systems of sort of patriarchy and stress on particular genders or liberation from them and trying to deal with them more equitably. Ensure universal, high-quality childcare for all families living in Vermont, and invest in the necessary facility infrastructure changes and increase support for and expansion of current programs, particularly in rural underserved areas. One thing we didn't talk about in these briefs is the impact of COVID, but we have heard from a few farmers about how COVID has really exacerbated their childcare issues. I have a 7-month-old here, and maybe you can hear her crying in the background. My mom's here with her. But folks who are full-time farmers, the task of staying at home with a child, particularly depending on the age or the ability of the child, is a very challenging ask. And it's putting a lot of stress on particular farms and farm families right now. So provide living wages, scholarship supports, and ongoing professional development and training to early child care educators, and enable them to both enter and remain in the field. And again, I think this is one of the advantages of cross-sector work, is we see the potential for solidarity, that we're not just talking about giving stipends to farmers to afford childcare. We're talking about what do the actual people in these professions need to be able to stay in these professions, to be able to do this work well, et cetera. Conduct research into how childcare costs, availability, acceptability, and access affects farm structure and management, and how these factors may evolve as children age. And conduct a comparative analysis between U.S. farmers and farmers in Western European countries where childcare and social support systems are more robust. So this really just points to the need for more research, and I would really point at Shoshana Inwood, Florence Beckcott, and Andrea Rissette's work, who helped us a lot on this. They've done it for Hired in Ag and a number of other organizations, great national work on the intersection of farm viability and healthcare and farm household health and healthcare. In this study, where we suggest a comparative analysis between the U.S. and places where these social support systems are present in its relationship to farm viability, I think would be very, very interesting to see. Integrate care work as a critical component of farm planning and child safety, and direct ag service providers to work with farms on this and educate those service providers to provide that kind of training. And work with Vermont DCF to simplify and expand the criteria for child care subsidies to make them more accessible to farmers, including pursuing an IT system that enables these changes. And I'll leave it at that and pass along to Sarah. We'll have questions at the end of this section.
Great, thanks. So the last brief that we wanted to just present to you that we felt fell in this big bucket of topics that need cross-sector coalitions is on workforce and education. So this brief is not as finalized yet as the other ones, and I'm only going to excerpt a few pieces of it. So Vermont's food system businesses are affected by the workforce shortage that's impacting all sectors in Vermont, and many report that a lack of employees with the required skills is holding back their production and growth. In order to sustain the growth of Vermont's agricultural economy, existing workforce solutions must be adapted for the unique needs of farms and food system businesses. Simultaneously, individuals living in Vermont often face difficulty finding careers that provide a livable wage despite the overall workforce shortage in the state, and need greater access to training and employment resources. So I just wanted to highlight just a few of the recommendations from this brief, because a lot of them are specific about very technical workforce programs. I just wanted to highlight a few that really stand out to me as requiring cross-sector coalitions. The first is that we've identified a need for the Vermont Agency of Transportation, regional planning commissions, regional development corporations, regional transportation providers, and food system business representatives, such as trade associations, to convene annually to identify appropriate solutions for overcoming transportation barriers. Transportation is a huge challenge that arises in food access and in workforce. We considered having a brief on transportation and we're not able to do one. So this is a really important topic for us for the breakout group discussions to figure out what are the actual next steps in engaging on transportation issues. The second one I wanted to highlight was the recommendation that Farm to Plate Network members, additional Vermont food system employers, and the Vermont congressional delegation should collaborate to identify adjustments to labor and immigration law that would improve both employers' ability to hire immigrants as well as workplace conditions and wages for those workers. So obviously a lot of equity considerations that need to be a part of the workforce conversation. And finally, the last one I wanted to highlight as an intersectional coalition opportunity is the need to support efforts by Vermont's career and technical education community to redesign the state educational funding model so that career and technical education institutions have independent funding streams and budgets and are not in competition with sending schools. So this is alluding to a complex facet of the funding for public schools in Vermont, where essentially high schools and tech schools end up competing for students for funding, which really holds back the ability to make sure students end up in technical education if that's right for them. So this is a big educational issue. It's a big policy issue. It's not something the food system can work on its own, but we've identified a real need to engage with educational advocates around this challenge. So before we get into the breakouts, which are, you'll have the chance to choose breakout groups on these specific topics that we highlighted to dive a little more deeper into them. But before we get into that, we did want to take a few minutes, hopefully pretty quickly since we are running a little behind, to go over any clarifying questions people have about the purpose of the session, the Farm to Plate plan, the specific content on these topics. And as another reminder, the first round of breakouts is on these specific topics to really dive into the weeds on actual next steps for the things we've highlighted here. And then the breakouts in the second half will be about strategies for coalition building in the Farm to Plate network in general.
Thanks, Sarah. Yeah, so folks can just pop any questions into the chat if they have them before we head into these breakout sessions. Maybe not. Well, if the questions come up, we can certainly address them. But so as we head into these breakout sessions, we have a few prompts here that we wanted to put in front of everybody to think about as we discuss these topics. And like Sarah said, we're going into topics around the specific briefs we just looked at first, and then our second session will be further discussion of strategies. So within the prompts, thinking about what stands out as most urgent to start addressing within the next 1 to 3 years, and what stands out as most important to address in the next decade, and what are some opportunities we see that could provide resources for support and multiple recommendations, and then priorities around the next steps. And I think I see one question popped up in the chat here. Oh, can we review the timing of the sessions this morning? So yeah, Sarah, do you have?
Yep, so we are here in breakouts until noon. So there's a 15-minute break roughly at the halfway point. It's a 2-hour and 15-minute session, and there's a 15-minute break roughly at the halfway point.
Alrighty. And then Sarah, are we self-selecting, or we're just gonna all break into smaller groups? And
yep, so I am opening the rooms now. If you have the newest update to Zoom, it should let you choose which room to go into. If you don't have the newest update of Zoom, message me in the chat and tell me which one of the rooms I can put you in there. So I've opened those rooms now.
And where do we find the
so yeah, if you have you should have a little breakout rooms button on your bottom toolbar with the little 4 square symbol. And if you click that, it should let you choose which one to go into. And if you're not seeing that, you might not have the latest version of Zoom, and can message me in the chat about where you'd like to go.
Great. And then we did just want to ask if within each of the groups, if everyone can pick someone from the group to report out when we come back together, because we'll have a little report out time as well. So if we have any more clarifying questions, please pose them now. Otherwise, I guess folks can start moving to organizing themselves within the rooms. And then Sarah, what's our reconvene time? When do we come back?
I will send, I'm going to start putting people into the rooms now. I have the ability to message all the breakout rooms, so I'll send people that once I have a moment to calculate that. But let me concentrate on putting people in the rooms yet for the moment. Oh yeah, so for those of you who don't have the newest Zoom and apparently obviously can't even see the names of the rooms, they are Food is Medicine, so the work that the Health Cross-Cutting team has been working on, Healthcare, like the brief Graham presented on, Childcare, and Workforce. Sorry for the clunkiness of doing this online, everyone. So Henry, Marissa, I might have missed it if you told me where you want to go. Whitney, you should, oh, okay. Heidi, where do you want to go? Food is Medicine?
Yes.
Okay, I sent you.
Sarah, would you mind putting me into the workforce group?
Yep.
Thanks.
And Kat, you have to duck out, right? You're not still there? All right, welcome back, everyone. It always feels so uncomfortable pressing the button to forcibly pull people away in the middle of a sentence. Let me. Graham or Heidi, I don't remember if one of the two of you was going to do lead some brief reporting out.
Yep, I think we were just gonna ask to hear some reporting out from groups. I can screen share again too to get our slides back up here.
And we can share in either the chat or raise your hand or just potentially just speak, as long as there's not too many at once.
We should have speakers from each of the groups, right? So we could just go through the different groups and enable those speakers, to report out. So let's see. So for the healthcare, right? There was the first brief healthcare. And do we need to give somebody mic access or whoever's reporting out for that group?
You all should be able to unmute yourself, but if you're struggling, pop a message in the chat and I can unmute you.
I know I was in that group. Does someone want to report out? I took some notes, but I'm happy to hear other people's voices here as well. I'll take that as it's fine for me to report out. I'll read a little list. I think, we did a lot more sort of just general brainstorming than like what's immediate and what's longer term. So I'll just read some of what we talked about. we had a number of different perspectives and people from different backgrounds in the group, which was great. So from the funding perspective, it seems like there's some more interest and willingness potentially to think about funding advocacy and more progressive work, especially in light of what's happening nationally. We have a couple of folks on the call who are, around age 26 and are sort of facing that reality of engaging with healthcare in a different way, and just how confusing healthcare is, and how, given how confusing the systems are. I mean, I'm 38 now, and it's still incredibly confusing. Like, how do you understand where to start working on this from a state policy perspective? We had folks from the sort of the more dietary world talking about bringing attention to nutrition, food access, playing a role in everything, and hitting at that intersection with how the healthcare world talks about food and how the food world talks about healthcare. We talked about just sort of the importance of preventative care versus reactionary care, and thinking about it in the COVID situation with its focus on the vaccine versus like what can we do why are certain populations being affected because of lack of preventative care, environmental conditions, et cetera. Talk about workplace safety importance, especially for farm workers. What barriers do we need to address to get all farm folks better care? There was someone who was at a NOFA roundtables conversation this last year with farmers in healthcare, and just heard farmers talking about considering the inability to farm based on encountering the cost of healthcare, and just that's a real reality, and how do we meet that as a farming world? And we talked. There was a lot of talk around the migrant farming community and folks without status. And an example of a program in Austin, Texas, brought up, which I think there's a link now to in the chat. I don't think that was just limited to our breakout group. And
you put it in the chat during your breakout. I think it only shows up for your breakout. So if you can
okay, so maybe
back.
maybe someone from our group can stick that program back in the chat, because that was awesome. And it sounds like just having those models for how other places are dealing with these issues sounded really important. This is a program where essentially affordable healthcare was achieved for the migrant community without status in this area, funded by big hospitals and universities, but only on a county level. So that's all, and I'm sure there was more. Sorry if I missed something important to somebody.
And then we have the childcare group. Do we have someone to report out there?
I guess I can hop in. Hi, I'm Megan Brakely, and apologies, my kiddos are running around in the background. We put some of our thoughts just into a quick Google Doc so we could see what we were working with, and I can put the link into the chat in a moment. But we talked about how intersectional approaches are urgent and critical for addressing childcare needs. We talked about some ideas around collective childcare and pooling resources, and then what is the regulatory landscape that prevents that from happening. We talked about more and affordable options in all counties in Vermont, especially with an emphasis on rural areas where transportation can also be incredibly limiting. We talked about some of the nuance of universal pre-K and how we can continue to improve that legislation, and also the rollout of how that program actually looks and works, and how certain technical details about where UPK is housed might hit farmers. So universal pre-K runs during the academic school year, which is not the time that farmers need that extra support for care. We talked about the intersection of and valuing of care work, and how community shifts in how we value the care work that happens could help transform our communities, in the sense that the average salary for childcare workers is around $28,000, usually without benefits, and families are paying huge amounts of their salaries for care, and you know, we need to make sure that everyone has an opportunity to have a viable go. We also talked a little bit about what we saw as a gap in the brief in thinking about broader exploration of family leave policy that would allow parents to, say, take a year off, and that would intersect with access to universal health care as well. And because there's putting a patch and just having more spots and more qualified educators. But if families actually could swing having the opportunity to put in the time and energy for that first year or that critical window of birth to 5, then we should be able to support them in doing that. We talked about some of the technical pieces around the federal Family Medical Leave Act, and how that businesses are only obligated to participate in FMLA if they have 50 or more employees. I'm pretty sure that's right. And how that precludes a lot of Vermont businesses from participating. And so it puts the onus on small business folks, and that doesn't seem quite right. And we talked about flexible or creative approaches for in-home providers. So I think that just sums it up. And we had a small group. And that'll, if I missed anything, Callie and Hannah, chime on in.
Thanks, Megan. If you can put the link to that Google Doc in the chat, that would be wonderful for us to have for our notes. Thanks so much for doing that.
All right, and then the workforce breakout group.
Hey everyone, Erica Campbell. So we were also very intersectional. We talked a lot about transportation, and in the beginning, both sort of from the lens of poverty alleviation and some of the groups in Vermont that are, you know, just working on getting folks to jobs. And then also Christine James brought up sort of the environmental side, and you know, it's so important that we move towards more environmental transportation and transit, et cetera. And we're not really quite sure how much those groups are really thinking about workforce needs. So that was just one intersection, or one thought we had that could be explored more. There was also some people in our group that were talking about workforce training connections. Marissa and Kyle brought up some great examples that we already have in Vermont, and more connections we can make kind of on the training side. And we also talked quite a bit about workers' rights, the role of essential workers, and the sort of workforce safety, workforce justice issues. And we talked about livable wage, the need for that. And then, yeah, also the challenge with, you know, farms with negative net income trying to pay livable wages makes for a really challenging situation, and that needs to be reconciled somehow. Farmers need to make more money. It would be the solution, I suppose. And then we also talked a little bit about immigrants and immigrant rights, migrant farm workers and their role, their very important role, but also, you know, thinking long term, what kind of food system do we want? And there's a lot of people, you know, Vermonters that also need jobs, and getting people into those jobs. There was a lot that we didn't touch on. I felt like, Sarah, sorry, the conversation was very, very broad and a little unwieldy. We probably could have talked a lot more on the training side, the role of CTEs, even state colleges. I don't know if that was mentioned in a brief, Sarah, I imagine it was, but that's a huge thing. Like right now, our state colleges are in a pretty rough state, and they're key to workforce training for the food system, and they should be even more so. So really thinking about the role that state colleges play could be yet another conversation we could have. And I probably missed some things, I apologize.
Thanks, Erica. And then we just had one more, our food is medicine group, and we had Danielle taking notes for us.
My hand is still recovering. I feel like there were a lot of really great thoughts, and I think the main point was that everyone in this group felt like this should be a priority now and always. I think it's something that can continually be looked at. I think other main themes were that there's momentum and need, and there was momentum and need around food as medicine programs before COVID, and COVID has kind of just extrapolated that need and the urgency of those programs. Two food as medicine programs that were mentioned as being successful cross-cutting programs were Salvation Farms Bounty Share with the Morrisville Department of Health and Cheslov, and interest in expansion into the NEK and Hardwick. Green Mountain Farm to School mentioning that they have capacity, transportation, and the interest, but that funding is the main concern for a lot of these programs. So there's a lot of discussion about if there was a way to do collective funding, either through Farm to Plate to be redistributed to these smaller programs, or to have programs apply to funding together and figure that out. That was a big conversation. There was another discussion of reaching out to groups such as housing coalitions and neighborhood groups to ensure that not only is food being accessed, but the supplies to use that food and to feed people are also being presented to those getting the food distributed to them. And then in terms of what Farm to Plate could look like in its next iteration, I think there's a lot of discussion about funding again, and then also Heidi made a great point about telling the Vermont story and collecting data across sections in order to secure that funding and kind of reinforce that narrative that there's interest, these programs are happening, how do we fund them to sustain them? I don't remember who it was, but someone mentioned maybe starting a campaign about highlighting success stories about connections that are cross-collaborative, and success stories of connecting folks with farmers or farmers to grocery stores, and kind of just expanding that narrative. I think that's everything. I don't know if I missed anything. Feel free to chime in.
Thanks, Danielle. I think, let's see, Sarah, on timing wise, do we have a few more minutes if folks wanted to share?
So I did a little bit of crunching. We are running significantly behind. I think we should probably go to a break, and if people are okay with taking 10 minutes instead of 15, then we'll still have a decent amount of time for another round of small group breakouts and discussion afterwards. But I think we should probably move into a 10-minute break now. Does that work for everyone? Thumbs up, Heidi and Graham. Okay. See you all in 10 minutes. All right, welcome back, everyone. Give just 30 more seconds for people. Great. Welcome back, everyone. Sorry, I'm attempting to multitask with technology again here. So this is sort of the part 2 of the structure. As I mentioned at the beginning, part 1 was focused on those specific topics, but now in part 2, we want to dive more broadly into the question of all of these cross-sector issues that keep arising. What does it actually look like for a food system network like Farm to Plate to engage on these issues? Or to put it a different way, Farm to Plate network is not an organization, it is its member organizations. So all of you are network members, or if you're not yet, you could be network members. So what role would you be excited to and able to, given your organizational restrictions, play as we venture into these non-food system specific issues? So that's like the overall guiding outcome that we want to get at in this last part of discussion. And as the slide you're seeing mentions, like we know this coalition building shows up in Farm to Plate briefs like food is medicine, healthcare, childcare, education, and as was being brought up in all of the breakout groups in the first part, there's a lot of other topics like immigration law, livable wage, housing, racial equity, transportation that don't necessarily have a brief themselves, but cross many briefs that we're thinking about engaging in this coalition work on. So with that, I will hand it to Heidi or Graham.
Thanks. Yeah. And I think Graham was going to speak to this slide, just offering some thoughts that we had about opportunities. And then like that, the group will discuss more in our breakout.
Yeah, thanks, Heidi. There, I think the goal here is just to sort of start the generation that we'll bring to the breakout groups, like Heidi just said. So
I'm sorry, can you get a little closer to your microphone again? Technology.
Phone.
Thanks.
Getting the phone and the computer are different devices. Yeah, so again, the goal is here just to begin the sort of generation of some thoughts around opportunities and why we do this work. And we sort of touched on this at the beginning, but these came up in our conversations. You know, we really see opportunities in growing solidarity and finding common ground and shared values between sectors, interest groups, broadening the pool of potential resources, capacity, funding, creating potential for addressing structural barriers, root causes, and sociocultural conditions which are necessary to really move the needle on certain issues, and just to better understand issues and how to respond from many perspectives. So I think what we're going to do is, again, just go forward to the next slide here, mention some challenges we saw, and then part of the breakouts is, you'll see the alternate prompts for the breakout, but it involves sort of thinking more about opportunities, challenge, work that's possible moving forward. So some of the challenges we brought up are just different professional languages we use in different sectors, our reluctance to engage outside of our own quote-unquote lane. I'm sure folks who have been pushing this kind of work have received that feedback at times, or certainly questions around what it means to be like an ag group working in healthcare. What does it mean to be an ag group working on racial equity outside of the ag system? Funding for cross-sector projects, finding common ground within differing goals. And then we just say, what else? And I think we were originally going to have like a little bit of opportunity to put some chat stuff out there, but because of the time, we're just going to bring it to this breakout session.
So I'll be sending them back into breakout groups. This time you won't be choosing, you'll just be sent in. You might have to click accept, but it'll be random. So this is, imagine if this was an in-person breakout session. So this is more sort of table talk with whoever happens to be at your table. Everyone will be addressing the same prompts. There's no specific topic division. So I will send you all into that now. We'll be pulling you back at 11:50.
better, yeah.
All right, welcome back, everyone. I'm trying to see if I can find Graham and Heidi and see if they're here yet.
Here.
Great, awesome. Heidi, I think if we don't share the slides again, since we don't really have a specific prompts for the report out, I think it's easier for everyone to see each other while we wrap this up. And then, yeah, I don't know if one of the two of you wants to take it away. Report out.
Yeah, I think we just had the thought here, like you're saying, like this is one of our moments here where we're all seeing each other, and can we just shout out some of what we took away from that last little discussion group before we close out our day. So I guess if folks want to go ahead and just jump in, right? I think we can manage that.
How many groups did we have?
We had 8. It did not divide people up very evenly, so some were smaller than others. People can feel free to unmute yourselves in chat, or if you're more comfortable with raising a hand, I'll try to monitor that as well.
We talked about Farm to Plate having opportunities where there's a meeting that's about a particular topic as opposed to a meeting focused around a specific kind of working group or cross-cutting team, so that everybody can bring their experience and their story to the topic, and there can be more intersectionality and coalition building across the network that way. And we also spent a lot of time talking about centering voices of Black, Indigenous, and people of color, and talking about how important it is to go to those groups that are doing food systems and farming work in Vermont, and ask them what their needs are and how the Farm to Plate network might be able to support them in an attempt for Farm to Plate to become more inclusive and intersectional. And anyone else from my group, feel free to add.
Yeah, I think in that way, the idea was like the next 1 to 3 years, really flip the script on trying to invite people in, and us, we have this enormous capacity for advocacy and energy behind efforts that other communities have, whether it's challenges accessing land or that kind of stuff, and really thinking 1 to 3 years is when we're putting our feelers out, developing relationships, understanding where there are synergies between communities' needs and what Farm to Plate has to offer. And as that develops out in the next 10 years, really building a more diverse coalition that is all kind of one in a way. I also want to just raise up that as someone who works with food service directors in hospitals, I think that there's this challenge when thinking about intersectionality of the intersection of various politics of specifically generally white people here in New England. One of my challenges has been figuring out how to really like build intersectionality into a somewhat conservative group of voices to pull in some of these topics that are good for all of us, but because of our politicized situation that we're in, seen as like weird lefty things, but really there's no need for them to be political. So that's a challenge that I run into quite often.
I can speak for our group if we're ready to move on to a new group. Sarah, I'm looking for your cue.
Yeah, we're not going group by group for this one, just more open. So go ahead, Tony.
Oh, we're not. Okay, well, I guess while my mic is on, we did talk about, again, it was sort of a broad conversation, but I think some of the points that I walked away with is sort of understanding the power dynamics between different groups, and that, when people are coming to the table, they're maybe not always feeling like they're standing on the same footing or coming from the same perspective. And so really just trying to be cognizant of like where that other group is coming from, and encouraging an environment where people feel like they're speaking on an equal playing field. And a lot of that can be not really, a conscious phenomena, but it's something that should be sort of kept in mind as we're talking to each other. And asking about who's not at the table, who should be. A lot of times, just when folks are at a table, it doesn't mean that everyone who's really got a relevant perspective is actually sitting there. So it just takes some active outreach and thinking ahead of time to make sure that you've really got a good representation of perspectives and organizations and people at the table for what you're talking about. And I'll if other people in my group want to talk about some of the other points we talked about, that would be great too. I don't want to monopolize it all. So.
I'll share really quick. One of the groups we talked about that we don't see at this table very often is youth. Kyle works at VYCC and brought up that we sort of asked into that a little bit. Like what kind of intersectional issues or what kind of coalition building and what kind of work can be done with this population? How do we bring them more to the table? And how do things like access to land and transportation and healthcare and simple education and experience around farming affect this population? How does the population invest in issues like climate change that are also intersectional issues? We brought up like how do we get more and better information to beginning farmers may not have much experience and may not be very good grant candidates because of that inexperience. Talked about how conventional dairy is not often at the table here at Farm to Plate, and there's definitely a bit more of an organizational representation versus farms and businesses at times, and the migrant farm worker community as well, and hoping to hear their voices here in this conversation more as well.
All right, I think we've got time for one more thought if anyone wants to share. If not, if any of you took notes in your breakout group and want to send them to me, we would love to have them. This is, as I've said, is really, this session is really important to figuring out how we structure the network moving forward to actually make progress on these issues. So I'd love to hear any of the thoughts or ideas you had, no matter how broad or how specific. Heidi and Graham, anything else to say before we send folks back to the main session?
Thank you all so much for participating, and I guess just like you're saying, Sarah, this is such a big part of the Farm to Plate work going forward. So I'm just excited how this session is going to inform a lot of our work to come.
Yeah, I don't think I have anything else to share. It's great to see so many folks interested in this and clearly doing work in these realms. Thank you all. It's great. I just haven't seen this many people, your faces in a room for a long time. I was sharing with one of the groups, and it's nice to see everybody.
All right, thanks everyone. And I put the link in the chat. It's the same link as you have on your PDF agenda or on the website. So the closing session will be one of these full Zooms, not the webinar too. So we'll get to see people from the whole Farm to Plate gathering. So see you there.